What is an ideal candidate for surgery?
Someone who's healthy, someone whose breasts are not currently developing, so your breasts are not getting larger. The same goes for patients who are losing weight. I know we talked about Ozempic earlier in the podcast, but if you're on Ozempic or another weight loss medication and you have large breasts, but you're rapidly losing weight, we don't know where that weight is going to come from. So if you're on a weight loss journey, then wait until that's stabilized before having any breast surgery and certainly breast reduction. Someone who is pregnant obviously is not going to have surgery, but after you've had the child, I tell patients to wait at least 6 months because, again, your breasts are changing after the pregnancy. So you want to make sure that you're at a stable point. If you're breastfeeding, you want to wait until you're at least 3 to 6 months done with breastfeeding before you pursue surgery. But for most women, being young and healthy or even older, I've done breast reductions on patients who are in their 70s who just put it off and are so happy with the results. So any age, as long as you're healthy, non-smoker, and pretty active, is okay.
And is there anyone that wouldn't be a good candidate for this surgery?
I think really there's very few people who aren't a good candidate for breast reduction surgery. When I used to do a lot of breast reconstruction surgery, there are patients who had had lumpectomies and radiation. Certainly, if your breast has been radiated, you are at a much higher risk of having complications with the breast reduction surgery. And I think if you're going down that pathway with a breast cancer, lumpectomy, and radiation, then you need to have that conversation with your breast surgeon that you're considering having breast reduction surgery because it's kind of off the table or a lot less options after you've gone through that treatment. And then smokers, you know how we don't love smoking.
Do not smoke.
I'll ask patients and I'll be like, okay, you're not smoking. Great. Don't start. So smoking cigarettes, any form of nicotine impairs wound healing. And we don't want anybody actively smoking prior to and after the surgery because it just does not go well with having a good postoperative course.
And what are your thoughts on marijuana? We get this question quite a bit if people are vaping.
Right. So again, I try not to come across as being like, oh, the doctor's saying it's bad, but nicotine does inhibit wound healing. So it is bad. Please don't, use it around surgery. Marijuana is there's no such thing as bad or good. I just don't want you smoking it before surgery because it's not great for your lungs. And so you're going to have this procedure under general anesthesia. And in order to reduce any side effects of having a general anesthetic, we would prefer that you just eat your marijuana in the form of edibles prior to and after surgery. So I think those are the things that we've been looking for is smoking, marijuana. And now we ask people about GLP-1s or Ozempic because as we talked about earlier in the podcast, it slows your digestive system down. And so you really need to be off of it for about 2 weeks before going under anesthesia so that you don't aspirate or vomit when the anesthesiologist puts you to sleep. So just being NPO, which is nothing to eat after midnight, doesn't work for someone who's on Ozempic or another GLP-1.
Yeah, I think transparency is super important. I feel like we've had a lot of patients that come in and then you're like, oh, I'm on nothing. And then the morning after, like, oh, by the way.
Right. Yeah. There is no reason to not tell us.
We do not care.
Yeah, we're not judging. We just need to know so that we can provide the safest experience for you. So